Skipping ahead to page 166. 166, page 166, an objection has been raised to committee amendment item number 388, number 1H.
Gentleman Fairfax, Mr. Simon.
Mr. Speaker, speaking to the amendment, or speaking to the objection. Mr. Speaker, members of the House, we have a problem in Virginia with mental illness and with our prison system. In Virginia, there's a 2015 study from the Compensation Board found we had over 7,000 of our incarcerated individuals in Virginia in regional local jails were suffering from mental illness. That's 1 in 4 prisoners in our prisons are suffering from some form of mental illness. This amendment removes funding totaling $2.2 million from the general fund each year and 11 positions for mental health services and probation and parole officers. Because the other problem we have is that these folks suffering from mental illness in prisons and jails are not being treated. And they get out, and their underlying mental illness that caused the criminal activity that got them into jail in the first place is not being treated. And so they come out, they maybe are served a portion of a sentence, they have a suspended portion of the sentence, and the probation officers that are dealing with them aren't equipped to deal with their underlying mental health problems. And so what ends up happening is they end up reviolating. And they end up back in prison, and we have a revolving door that happens. You know, we in Fairfax are about to interview a bunch of new juvenile domestic relations court judges. I had one in my office this morning, an experienced judge who'd done some substitute judging, and told me about a case that had happened to him just last week. He had a person before him who had violated probation. He had a suspended sentence of 365 days. The guy was bipolar. He had gone off his meds. He'd violated his probation. He was back in front of that judge. He had gotten back on his medication. He was back getting the treatment he wanted, but the probation officer was recommending that he go to jail. Okay, that's not the right answer. And the judge said, that's not the right answer. Why is this person back in front of me? This person isn't bad. This person is sick. This person needs help. This person needs to be directed to the proper services so they can be treated. They don't belong in prison. And this language, removing $4.4 million over the next 2 years, to equip those probation officers and parole officers to catch those cases, understand the difference between people that need to be in jail and those that don't. Taking that out is a real missed opportunity, Mr. Speaker and members of the House. And I know why this money is going away. It's going away because the next objection that I've got is because we're going to need to put much more money into regular medical services for people in our prisons and jails because they are not eligible for Medicaid and because we haven't expanded Medicaid. So, Mr. Speaker, members of the House, I would hope that it would be the pleasure of the House to reject this amendment.
Gentleman from Prince William, Mr. Lingenfelter.
Thank you, Mr. Speaker. I hope it will be the pleasure of the House to accept the amendment. This money was essentially repurposed to address an almost 500 person shortfall in the Department of Corrections that really needs to be addressed. The committee, in doing so, is taking $3 million and adding an additional 53 prison guards to what the underlying budget did. So now we will have a total of 89. If you go to the next page, you'll see in the budget where we have actually inserted those 53. And that's almost, I might add, a 20% increase in the number of correctional officers that we now will have at work in Virginia. And if you have correctional officers in your district, believe me, this is a bill, this is an amendment you want to support. Expanding the mental health services through existing programs was done with the expansion of eligibility in the GAP program that we just discussed. And when the DOC came before our subcommittee, I'd say to those concerned about this amendment that the DOC wasn't even aware of the GAP program. And so the GAP program may well be used to address some of the issues that the gentleman brought up, but I guess you have to actually work inside that program in order to do it. I would hope that you support the amendment.
The gentleman from Henrico, Mr. O'Bannon.
Speaking to the amendment briefly.
Gentleman has the floor.
I hope you'll support the amendment. Delegate Lingenfelter clearly defined that we took basically the whole package in the administration's proposals for the gap funding in mental health and substance abuse services. And it also reminds you on page 130, we have specific language and another part of the budget for us to do an outreach to DOC and local jails, because this issue is important to all of us. So, yes, it's tough prioritization, but we're all very focused on this issue. I think it is addressed in the budget, and I hope you'll support the budget amendment. Thank you, Mr. Speaker.
Shall the committee amendment be agreed to? The clerk will close the roll.
Ayes 73, noes 26.
Ayes 73, noes 26. The committee amendment is agreed to.